is Michelle Mclaren, and welcome to the ABCs of Health Insurance. I'm a licensed health insurance broker in the state of Texas with my own agency, Just the Facts Insurance Agency. I am also a licensed health insurance counselor. I'm here to help explain the confusion that is health insurance, especially for individuals. Insurance is evil, so let's turn evil into easy with answers. Today's letter is C. C stands for both copay and co-insurance. These are both important parts of how your insurance works and is priced, but can be confusing for people. A copay is a fixed amount that an individual pays for a product or a service. A doctor's office copay is usually somewhere between $25 and $50, and that covers your basic visit. Sometimes you can get charged more if you have to have some lab work done or x-rays, or sometimes that's included in the copay. It depends on your insurance plan. There may be higher copays if you go to an urgent care center or an emergency room or get admitted to the hospital. Many plans also have copays for medications, especially generics. And the advantage of those copays is that you know exactly how much you're going to be paying in advance. The disadvantage is that the set amount means that the insurance company has to pay the rest of your fees right away. This is called first dollar coverage. The insurance company has to pay with the first dollars you spend. Since they are paying right away, they're going to charge you more in premiums, sometimes quite a bit more. If you don't go to the doctor often, is it worth paying more premium monthly to have a copay when you get there? Some companies have gone to having a limited number of copay visits to split the difference on this premium increase. As always, you have to look at the whole year's expenses and figure out what's best for you. If your plan has copays and you're also not going to qualify for a health savings account or an HSA, this can save you the taxes on money that you pay for medical expenses. Coinsurance is completely different from copay. When you have a health insurance plan, you usually have a deductible up front. This is the amount of money that you pay for goods and services before the insurance kicks in. If your plan does have copays, they usually do not apply to your deductible. They do apply to your max out of pocket, thanks to the Affordable Care Act. Once you've met your deductible, you may have a responsibility to continue paying towards that max out of pocket a percentage of your bills until that max has been reached. That percentage is usually somewhere between a 0% or 50 to 50%. Most common is 80-20, where you're paying 20% of those bills. The higher coinsurance percentage, the lower your monthly premium will be. So if you agree to pay 50% coinsurance, you're going to have a lower monthly premium than if you're paying 20% coinsurance. If your plan has 0% coinsurance, this means that your deductible and your max out of pocket are the same. This is common in those plans that have HSA qualifiers or health savings plans. One little tricky bit in reading the insurance policy documents is not all of the insurance companies report their coinsurance the same way. However, you usually pay the lower percent. So if it's an 80-20 plan and it lists 80% on your insurance policy documents, you're paying the 20%. How does this work in your life? In actuality? Let's say you have a policy with $40 doctor copays, $200 ER copays, a $5,000 deductible, and 70-30 coinsurance to a max out of pocket of $7,350, $7,350. This would be a common plan in today's individual marketplace. You go to the doctor with stomach pains and he charges you a $40 copay. That's pretty easy to figure out. But he thinks you might have appendicitis, so he sends you to the ER. Then they charge you a $200 copay and then $500 for testing. They finally admit you to the hospital for surgery, which costs $10,000. Yes, I'm making all of these numbers up. The $240 in copay is subtracted from your max out of pocket, so now you have $7,110 left. Then the $500 gets subtracted from your deductible, leaving $4,500 for your deductible left. You would pay the first $4,500 of the hospital visit to finish off your deductible. Since your deductible also applies to your max out of pocket, this means your max is now down to $2,110. Then you would pay 30% of the remaining hospital bill, or 30% of $5,550, which is $1,650. At the end, your bill is paid. You have $460 left before you meet your max out of pocket for the year. That's clear as mud, right? Absolutely. Both copays and coinsurance directly affect your insurance premiums. When you're choosing your insurance, you need to think about your normal medical usage, your monthly budget, what can you handle in an emergency, and your total for the year to choose the best plan. Thank you for taking the time to listen to me today, and I hope you found this information helpful. Do you have other insurance questions? Check out my other videos or leave your questions in the comments. Education is important, and that's why I created Just the Facts Insurance Agency. It's just the facts you need to protect those you love.